This is not a hospital, not a clinic. This is not a doctor's office, not a pharmacy. This is truly a money machine. In 2025, United Health Group collected $447 billion in revenue. Collectively, this is more than Apple. It is more than JP Morgan Chase. It is more than the energy giant ExxonMobil, the single largest company in the United States by revenue. And almost nobody knows how it works. Here is exactly what they don't teach you. United Health's actual insurance business, the part that pays your claims, lost ground in 2025. Its margin collapsed to 2.7%. This is total collapse. This was the worst it had been in a decade, and yet the company made billions, making more than it has ever before. Because that money never actually left. Every dollar that left the insurance arm, called United Healthcare, traveled directly into another United Health company. It went to a United Health doctor. It went to a United Health pharmacy. It went to a United Health algorithm. In 2025, nearly $190 billion moved from one United Health pocket to the other, legally and very deliberately, using a mechanism written into the law that was designed to protect you. This now raises three questions. Question 1. If the insurance arm is collapsing, how is the company more profitable than ever? Question 2. On the morning of December 4th, 2024, the CEO of this company was shot twice on a Manhattan sidewalk, killed before he reached the investor conference he was walking to. The public response was not a response of grief, it was applause. And we must ask, why? And question 3. The United States government has been paying United Health more than $200 billion a year. Federal investigators believe the algorithms United Health built, the ones that determine what care you receive, may be fraudulent. Criminal. What happens to the American healthcare system if they are right? Strategy Lens publishes forensic documentaries on the companies that actually run the global economy. This is not from the press releases or the investor decks. This is the architecture underneath, the financial mechanics, the political relationships, the decisions that get made at 2 a.m. that nobody reports on. If that is the kind of information you want, you should subscribe now. The people watching this channel understand the world differently than almost everyone else. Now, back to United Health, because the origin of this machine is stranger than almost anything that followed it. 1977, a physician named Richard Burke founds United Healthcare Corporation in Minnetonka, Minnesota. He had a vision. The premise is simple. Managed care, a model to manage every single patient. Instead of paying doctors for every procedure they perform, which creates a financial incentive to do more procedures, Burke's idea is to pay a flat monthly fee per patient and let doctors manage their health proactively. The theory: keep people well, pay less in claims, everyone wins. A simple idea with massive consequences. The idea isn't new, but what Burke builds becomes something the theory never anticipated, something far larger. In 1984, United Healthcare goes public on NASDAQ. The market values it at roughly $100 million, a watershed moment. It is a standard regional health plan, Midwestern, conservative, unremarkable. But that would change soon. Then comes the first decision that will define the next 4 decades, a decision that shifted everything. 1987, United Healthcare acquires PHP, a health plan subsidiary of Physicians Health Plan of Ohio, the first move. Then it acquires Peak Healthcare. Then it buys Physicians Health Plan of New Jersey. One after another, year after year, always the same playbook, every time. Find a company that already has the patients, the licenses, the market relationships. That was the game plan. Buy it, fold it in, expand the territory. This was the growth engine. By 1993, United Healthcare is one of the largest managed care organizations in the country, a dominant force. And then it makes an acquisition that nobody fully understood at the time, but which turns out to be the most consequential corporate bet. In 1995, United Healthcare acquires Metra Health, the merged health benefits operations of Metropolitan Life and the Travelers Group. One transaction, 2.8 million new members, a massive influx of patients. Overnight, UHC becomes a national powerhouse, not through organic growth, but through simple financial logic. The lesson gets written into the company's DNA. The fastest way to grow is to buy. Always buy. And the most powerful thing you can own is not a product, it is infrastructure, the rails of the system. In 1990, United Healthcare acquires a small data company called Diversified Pharmaceutical Services. In 1997, it acquires a company called Ingenix. Ingenix does something that sounds boring: data and numbers on a screen. It publishes databases, specifically databases of usual, customary, and reasonable rates for out-of-network medical procedures. These databases are used by virtually every insurance company in America to determine how much to reimburse patients when they see a doctor who is not in their network. Here is what nobody noticed at the time: a hidden conflict. United Health owned the database. They owned the very information used to set the rates. United Health was also one of the largest users of the database. The judge and the jury, and the data internally was being systematically skewed downward. A intentional bias. Artificially low reimbursement rates, legitimized by a database United Health controlled. Patients paid the difference. They were left to cover the costs that the machine reduced. For over a decade, this will continue without public consequence. The machine hummed on. The American Medical Association will eventually file a class action lawsuit alleging ERISA, RICO, and antitrust violations. The settlement in 2009 will cost United Health $350 million, a massive price to pay. Ingenix will be forced to scrap its database entirely, the end of an era. And United Health will rebrand Ingenix as something new, something that in 2026 controls the data architecture of the entire American healthcare system. They would call it Optum Insight, the new machine. But the Ingenix scandal is not even the most audacious move of United Health's early era. That honor belongs to a man named William McGuire, the architect. Dr. William McGuire became CEO of United Healthcare in 1991. He is a physician by training, rare for an insurance executive. And under his leadership, the company that Richard Burke founded in a Minnesota suburb becomes one of the most powerful financial entities in American history. Between 1994 and 2005, 11 years, United Health's executives engaged in a practice that the Securities and Exchange Commission will later describe as one of the most egregious governance failures in modern corporate history. And so, they backdate stock options, a simple clinical theft. The mechanism is almost elegant in its cynicism. Instead of granting stock options on the day they are approved, which is the law, executives look back over historical market data. They find the single lowest stock price in the preceding weeks or months. They retroactively grant options dated to that day. Result: the options are immediately in the money, risk-free, guaranteed profit from the moment they are issued. The accounting treatment hides the true cost of executive compensation from auditors and shareholders. McGuire received over 44 million split-adjusted options through this scheme. A Wall Street Journal investigation breaks the story in March 2006, a Pulitzer Prize-winning piece. The resulting fallout forces United Health to restate its earnings by $1.526 billion. McGuire is immediately forced out of the company. He surrenders over $600 million in options, retirement benefits, and cash, including $468 million in direct SEC disgorgement and a $7 million personal penalty. He is barred from serving as an officer or director of any public company for 10 years. The board replaces him with Stephen Hemsley, a low-key, operationally precise executive who had been COO. Hemsley's mandate: clean up the ethics, rebuild the reputation. What he actually does is far more consequential: a complete overhaul. He takes the acquisition playbook and makes it systematic. And he makes a single bet that transforms what United Health is. Not just how big it is, but what kind of entity it becomes. He creates the machine called Optum, a new foundation. 2011, United Health rebrands its health services division as Optum. On paper, it is merely a subsidiary, a minor division. In reality, it is the beginning of the machine, the real engine. And here is the first clue that something extraordinary is being constructed. Optum doesn't just serve United Health customers, it sells its services to competitors. CVS, Cigna, Aetna, regional Blue Cross plans, industry giants. United Health subsidiary becomes the back office infrastructure for the entire insurance industry it competes against. A seed has been planted that almost nobody notices in 2011. The company that sells you health insurance is quietly becoming the company that runs health insurance for everyone else too. The distinction will matter enormously and become deeply dangerous within a decade. Most people think of United Health as an insurance company. That misunderstanding is the most profitable misunderstanding in American business history. The Affordable Care Act passes in 2010. Most large insurance companies see it as a regulatory threat. Higher costs, profit caps, mandatory coverage requirements. United Health sees something else entirely. The ACA contains a provision called the Medical Loss Ratio, the MLR rule. It mandates that insurance companies must spend at least 80 to 85 cents of every premium dollar on actual medical care. No more than 15 to 20 cents can go towards administrative costs and profit. The intent: cap insurance company greed, force them to pay for care. Here is what Stephen Hemsley and his team see that almost no one else does. The rule says you must spend 85 cents on medical care. It does not say you cannot own the company that provides the medical care. When a United Healthcare member sees an independent doctor, that money leaves the United Health ecosystem. When a United Healthcare member sees an Optum doctor, that money pays a United Health medical expense, satisfying the MLR requirement, and then a portion of it becomes Optum operating profit. Optum has no medical loss ratio cap. Not 1 cent is applied. It is a services company, a technology company, a pharmaceutical management company. It is completely outside the regulation that was designed to contain insurance profits. The insight is staggering in its precision. The more aggressively United Health can route patients from its insurance arm into its Optum subsidiaries, the more it can satisfy federal regulations while simultaneously capturing margin that the law was designed to prevent. And so begins the most sustained acquisition campaign in healthcare history. 2015, Catamaran Corporation acquired for $12.8 billion. OptumRx now controls 15 to 20% of the pharmacy benefit management market. 2017, Surgical Care Affiliates acquired for $2.3 billion. Optum now owns ambulatory surgery centers across 30 states. 2020, Navi Health acquired for approximately $2.5 billion. A company that uses algorithms to determine how long Medicare patients should stay in rehabilitation facilities after surgery. 2022, LHC Group acquired for $5.4 billion. Home Health Services. Optum now follows patients into their homes. 2022, Change Healthcare acquired for $13.0 billion, the clearinghouse that processes 15 billion medical transactions per year, including claims from United Health's own competitors. Read that last one again, very carefully. United Health acquires the company that processes claims, including the claims of the insurance companies competing against United Health. The Department of Justice sues to block the acquisition. A federal court rules in United Health's favor. Optum has no medical loss ratio cap. By 2022, UnitedHealth Group isn't just the largest health insurer in America. It processes the billing infrastructure for the competitors it's trying to beat. It employs more physicians than any other entity on earth. Eventually, over 100,000 aligned providers. It runs one of the 3 largest pharmacy benefit managers on the planet. It owns the analytics engine that its own competitors license to manage their own patients. The flywheel is complete. It is now unstoppable. United Healthcare collects the premium. Optum provides the care. Optum RX fills the prescription. Optum Insight analyzes the data. Optum Financial holds the cash. The dollar enters at one point, it travels through the entire system, and it never leaves. Now pause. Let that register. You just heard about a decade of brilliant strategic execution, vertical integration, capital allocation, regulatory arbitrage. And if you're watching this as an investor, that probably sounds like genius. But here is the question that the financial press almost never asks. When United Healthcare routes a patient to an Optum clinic, is that because the Optum clinic is the best possible care for that patient? Or is it because the financial architecture of the company creates $1 trillion incentive to send patients there regardless of quality? When Optum Rx manages your prescriptions, is it designed to get you the most effective drug at the lowest price? Or is it designed to maximize the spread between what drug manufacturers pay and what patients pay, with the difference landing in Optum Rx's revenue? The FTC will eventually sue Optum Rx for exactly this, alleging that the pharmacy benefit manager artificially inflated insulin prices, demanded massive rebates from drug manufacturers, and pocketed the spread rather than passing savings to patients. The answer to how this empire was built and who paid for it turns out to be the same answer. You did. You paid for it. This was the machine. This was the machine they. But the rise is only half the story. What nobody knows, what this company has spent decades and billions of lobbying dollars ensuring nobody knows, is how the machine actually works underneath. And that is where everything changes for everyone. Every year, UnitedHealth Group files a document called a 10K with the Securities and Exchange Commission. This document is hundreds of pages long. Most investors skim the revenue numbers and the executive summary. What almost nobody reads is the footnotes, specifically a line item buried in the segment reporting section. It is labeled Eliminations, $150.9 billion. That is the amount of money that United Healthcare paid to Optum in 2024. Internal transactions, one pocket to the other. Called eliminations because in a consolidated filing, you subtract the money that moves between subsidiaries. Otherwise, you'd be double counting revenue. In 2025, that number approaches $190 billion. $190 billion moved internally out of a total consolidated revenue of $447 billion, meaning more than 40 cents of every revenue dollar United Health reports is money the company paid to itself. This is not fraud. This is not illegal. Result: the options are immediately in the money, risk-free, guaranteed profit from the moment they are issued. And understanding it answers the first question we asked in the opening of this video. Here is how a company with a collapsing insurance margin remains the most profitable healthcare company on earth. When United Healthcare pays an independent hospital for a patient's surgery, that money leaves the United Health ecosystem. UHC records it as a medical expense. It satisfies the 85% medical loss ratio requirement, and it's gone. When United Healthcare pays an Optum Health physician for that same surgery, the money stays inside United Health. UHC records it as a medical expense. It satisfies the MLR requirement. But then Optum records it as revenue and books a profit margin on top of it. That profit faces no federal cap, no medical loss ratio, no regulatory ceiling. The company has engineered a structure where the act of paying for healthcare, an act that the federal government mandates, becomes the mechanism of profit generation. Not despite the regulation, because of it. Now pause. Let that sink in. The numbers make this concrete. In 2024, United Healthcare generated $298 billion in revenue. Its operating margin, 5.2%. In 2025, as Medicare Advantage funding was cut and the medical care ratio spiked to 88.9%, UHC revenue surged 16% to $344 billion. But the operating margin collapsed to 2.7%. The insurance arm was hemorrhaging. Simultaneously, Optum in 2024 generated $253 billion in revenue at a 6.6% average operating margin. Optum Insight, the data and analytics division, routinely operates between 16% and 20% margins. No regulator caps that margin. No federal rule limits it. The only limit is how much business Optum can win, and its largest single customer is its own corporate sibling. This is what forensic accountants call transfer pricing risk. Optum Insight charges United Healthcare for data analytics, risk scoring algorithms, and claims processing software. Optum Rx charges UHC for pharmacy management. Optum Health charges UHC when its physicians treat UHC members. The rates for all of these internal transactions are set by United Health Group itself, reported publicly in the eliminations line, and are effectively invisible to the market. A company that is both the buyer and the seller controls the price of everything. The government relationship makes this even more consequential. As of 2025, over 60% of United Health's total revenue comes directly or indirectly from the federal and state governments. Medicare Advantage, Managed Medicaid, TRICARE, CMS, the Centers for Medicare and Medicaid Services, contributes approximately 40% to 44% of United Health's consolidated revenues. The company that the public perceives as a private sector giant is, in structural terms, the largest government healthcare contractor in United States history. Now pause. Look at those numbers. And this is where the question from the opening becomes genuinely alarming. The third question we asked: the US government pays United Health more than $200 billion a year. How much of that money is earned legitimately? The mechanism that determines how much Medicare pays United Health for each member is called risk adjustment. The sicker the patient appears on paper, the more medical conditions they are coded as having, the higher the monthly payment United Health receives from the government. This creates an incentive structure of extraordinary consequence. The more diagnosis you can attach to a patient, the more money flows from Washington. United Health built the tool to do exactly this, and it is Optum Insight. Optum Insight's natural language processing algorithms scour patient medical records. They identify diagnoses that may have been mentioned in passing, a doctor noting a patient's controlled hypertension, and flag them as active conditions for risk adjustment coding. Simultaneously, Optum Health sends clinical staff on in-home assessment visits. The purpose is ostensibly preventive care. The financial reality is that these visits also generate risk-adjusted coding opportunities. The more complete the assessment, the more conditions identified, the higher United Health's monthly payment from the federal government. Internally, this program was reportedly called Project 7. Its stated goal: a $100 million income boost from enhanced risk coding. Federal investigators have a different name for it. The Department of Justice has actively investigated United Health under the False Claims Act for what it calls upcoding, characterizing patients as sicker than they actually are to extract higher Medicare payments without providing additional treatment. A former United Health employee named Benjamin Poling filed a whistleblower suit in 2011 alleging systematic fraud. The DOJ intervened in parts of the case around 2017. By 2025, investigators had identified alleged overpayments of more than $7 billion. A criminal probe targeting not just civil fraud but potential criminal Medicare fraud was reported active as of 2024 and 2025. United Health denies wrongdoing. It characterizes its risk adjustment practices as standard industry procedure, which raises the most uncomfortable possibility of all. What if it is right? What if everyone is doing this? What if the entire Medicare Advantage industry is engaged in the same practices and United Health is simply the most sophisticated practitioner of a game that the government designed? This is the scale of the game. It is designed to be won. The day's claims payable metric gives us one more window into the hidden financial architecture. When United Health collects a premium from your employer, it holds that money before paying claims to doctors. In Q4 of 2024, the average time between collecting the premium and paying the claim was 47 days. In Q4 2025, it was 44 days. 44 days of float, holding money that technically belongs to providers across a $447 billion revenue base. Meanwhile, the time it takes for United Health to collect money owed to it from employers paying premiums was 18.8 days. United Health collects in 18 days, it pays out in 44 days. That 26-day gap across that revenue base represents tens of billions of dollars sitting in United Health's hands at any given moment, earning interest. A permanent, involuntary, interest-free loan from the American healthcare system to United Health Group. And there is one more structure that operates almost entirely out of public view. When Optum acquires a physician group, and it has acquired hundreds, it faces a legal obstacle. Most states have laws called corporate practice of medicine statutes. These laws prohibit corporations from practicing medicine. The physician must technically own the clinical entity. United Health Solution. the Management Services Organization, the MSO. Optum creates a management company. The physician group technically owns the clinical practice. But Optum's MSO owns the real estate, the technology, the billing infrastructure, the administrative systems, and the brand. The MSO charges the physician group for all of these services. The fees are set by Optum, and they are set at a level that extracts nearly all of the net profit from the clinical practice, legally transferring it into UnitedHealth's consolidated balance sheet. The physicians nominally own the clinic. UnitedHealth owns everything that makes the clinic function and captures everything the clinic earns. This is the hidden machine, not a conspiracy, not a secret. A legal architecture so layered, so precisely constructed that it operates in plain sight, disclosed in SEC filings, visible in the annual report, invisible to almost everyone who reads it. February 21st, 2024, 4 a.m. Eastern Standard Time. A Russian ransomware group called ALPHV, Black Cat, infiltrates a server at Change Healthcare. The entry point: a remote access portal with no multi-factor authentication, a billion-dollar acquisition, a $13 billion corporate asset, a system processing 15 billion healthcare transactions per year, protected by the same security standard as a personal email account. Within hours, UnitedHealth severs Change Healthcare from the internet. The move stops the spread of the ransomware. It also stops the entire financial plumbing of the American healthcare system. Pharmacy authorizations were halted. Piles of medicine went nowhere. Insurance claims processing halted. Hospital revenue cycle management halted. Because Change Healthcare processed approximately 44% of all US medical claims, including claims for hospitals and insurers that had no relationship with UnitedHealth. The shutdown affected providers that had never signed a single contract with UnitedHealth Group. In the first 3 weeks alone, hospitals lost $6.3 billion in cash flow. Small independent practices, already operating on thin margins, faced immediate insolvency. UnitedHealth paid a ransom, a clinical digital theft of millions, $22 million in Bitcoin to ALPHV Black Cat. The ransom did not secure the data. The gang took the money, then allegedly failed to pay its own criminal affiliates, who responded by leaking the data anyway. A second ransomware group called Ransom Hub then extorted UnitedHealth again with the same stolen information. By the end of 2024, the direct cost to UnitedHealth had reached $2.45 billion. An additional $2.8 billion charge followed in 2025. Total over $5 billion in direct costs from a single cyber attack. 192.7 million Americans had their medical data, social security numbers, diagnoses, medications, insurance identifiers exposed on the dark web, the largest healthcare data breach in the history of the world. To prevent mass hospital bankruptcies and head off congressional intervention, UnitedHealth was forced to act as a central bank. It issued $9 billion in emergency, interest-free advances to providers it had paralyzed. The very infrastructure designed as a competitive moat became a liability to the entire country. The infrastructure failed, and so Congress called the CEO. In May 2024, UnitedHealth CEO Andrew Whitty testifies before Congress. He admits that the infiltrated server lacked multi-factor authentication. He admits that one of the most critical pieces of healthcare infrastructure in the country was vulnerable to the most basic known attack vector. The senators listening to this testimony are not medical experts, not technology experts, but they know what multi-factor authentication is because their email accounts have it. The reputational damage is compounded by what is happening simultaneously in federal court. In November 2023, a class action lawsuit is filed in the U.S. District Court for the District of Minnesota. The case: Estate of Gene B. Loken et al. Versus UnitedHealth Group. Gene Loken was 91 years old. He fractured his leg and ankle. He was admitted to a skilled nursing facility. His physicians recommended continued care. An algorithm called NH-Predict, owned by a company called NaviHealth, which UnitedHealth had acquired for $2.5 billion, determined he had been there long enough. His coverage was cut. His care was terminated. Just like that. His family paid approximately $14,000 per month out of pocket. Loken died approximately a year later. a tragic outcome. The NH Predict algorithm, according to the lawsuit, had an error rate that federal administrative law judges overturned on appeal over 90% of the time. But the business model relied on attrition. Less than 1% of patients ever filed a formal appeal. The algorithm was wrong almost every time it was challenged. Every single time. And almost nobody ever challenged it. They simply gave up. The overturn rate was 90%, a systematic failure. A 2024 US Senate investigation confirms the broader pattern, a pattern of denial. United Healthcare's prior authorization denial rate for post-acute care, rehabilitation facilities, skilled nursing surged from 10.9% in 2020 to 22.7% in 2022, a more than doubling in 2 years, from 10% to over 22%. The Senate report explicitly links this surge to the rollout of automation, the same tools designed to reduce review time by 6 to 10 minutes per case. Faster, cheaper, more denials. This was the automated machine. And now we arrive at the second question from the opening of this video. December 4th, 2024, 6:44 a.m. The time the world stopped for one man. Brian Thompson, CEO of UnitedHealthcare since 2021, steps out of a Marriott on West 54th Street in Manhattan. He is walking to an investor conference, 1 block away, just 1 block. He never gets there, on that cold Manhattan sidewalk. A 26-year-old named Luigi Mangione, Ivy League educated, tech industry background from a prominent Maryland family, has been surveilling the area for days. He fires twice with a suppressed, partially 3D printed 9mm pistol. He has written 3 words on the shell casings: deny, defend, depose. Brian Thompson is pronounced dead at 7:12 a.m. ACEO is gone. What happens next is unlike anything in the history of American corporate violence. When United Healthcare posts a bereavement message on social media honoring their late CEO, the post receives over 77,000 laughing emojis. The company is forced to lock its comment sections. Silence was the only option. A poll conducted by Cloud Research finds that nearly 25% of Americans are at least somewhat sympathetic to Mangione. Among Americans under 30, 42% express sympathy. The generational divide. 11% of total respondents are actively supportive of the killing. This is not politics. This is not ideology. This is a country telling a corporation something that 4 decades of regulatory enforcement, congressional hearings, and shareholder activism had failed to communicate. Thompson's tenure at United Healthcare had coincided with the acceleration of AI-driven claim denials. The Senate report on prior authorizations landed in October 2024, 8 weeks before his death. The class action lawsuit over NH Predict had been filed the previous year. A Florida pension fund had sued Thompson and other executives for insider trading, allegedly dumping $102 million in stock before a DOJ antitrust probe became public. The public did not mourn the man. They mourned the system they believed he represented. And in their refusal to perform grief on cue, they revealed something that had been building for years. The trust between the American public and the private health insurance industry had been functionally destroyed. The trust was destroyed, functionally gone forever. United Health stock had been trading around $605 per share before the shooting. In the weeks that followed, it lost $63 billion in market capitalization. The stock would eventually fall further, losing 42% of its value by July 2025 as the DOJ criminal probe into Medicare fraud became public. The earnings guidance was suspended and the medical care ratio hit 88.9%. And in May 2025, the CEO who had inherited this crisis, Andrew Whitty, resigned, citing personal reasons. The board brought back the man who had run the company during the options backdating scandal nearly 20 years earlier, Stephen Hemsley. A recursive failure playing out in slow motion. The machine turns back. The facts of this story are not in dispute. What is in dispute is how to interpret them. So before we reach a verdict, we owe United Health the same forensic rigor we'd apply to any entity under examination. What does it do well? What has it broken? And what would a smarter version of this company actually look like? Now let's examine what United Health Group does brilliantly. First, scale as a genuine competitive advantage. United Health serves approximately 49 million insured Americans and supports 123 million consumers through its Optum services. At this scale, it can negotiate lower drug prices, achieve administrative efficiencies, and deploy technology at a cost per member that no mid-sized insurer can match. Its mobile app, the consumer-facing product, holds a 4.7 out of 5 rating from over 700,000 App Store reviews. Users hate the policies. They like the product. That distinction matters. Second, value-based care, when actually executed, works. Optum Health's value-based care models, where physicians are paid a flat fee to manage a patient's overall health rather than per procedure, have demonstrated genuine cost reduction. United Health claims 30% reductions in total cost of care in some value-based models. When the incentive is to keep people healthy rather than to treat illness, patient outcomes improve. The concept is right. The application has been distorted by the profit architecture around it. Third, capital allocation discipline. In 2024 alone, United Health returned $16 billion to shareholders through dividends and buybacks, while still generating $24.2 billion in operating cash flow. The company has raised its dividend consistently for over a decade. For institutional investors managing pension funds that millions of ordinary Americans depend on, United Health's cash generation record is one of the most reliable in the S&P 500. However, this architecture conceals three fundamental structural failures. First, the conflict between payer and provider is not manageable. United Health is simultaneously the entity that decides whether you receive care, the insurer, and the entity that profits from providing that care, Optum. These interests are structurally incompatible. When an Optum physician recommends additional treatment, the insurance arm has a financial incentive to deny it. When an Optum facility generates more procedures, the insurance arm's medical loss ratio rises. The company is in constant internal conflict between profit centers, and patients are the variable the system optimizes against. Second, concentration risk has reached a critical threshold. Change Healthcare processing 44% of all US medical claims is not a competitive advantage. It is a national security vulnerability. When one company's legacy IT infrastructure becomes the central nervous system of an entire industry, the failure of that infrastructure, as proven in February 2024, can paralyze the country's ability to deliver and pay for healthcare. The DOJ blocked the merger. A court overruled it. The court was wrong. Third, the algorithm-driven denial model is not sustainable. A care authorization tool with a 90% overturn rate on appeal is not a utilization management system. It is a probabilistic bet that sick people won't fight. When 99% of patients don't appeal, not because they agree with the denial, but because the process is deliberately designed to exhaust them, that is not clinical medicine. Ultimately, what we are witnessing is statistical cruelty. And now, to answer the third question we opened with, what happens if the DOJ criminal probe is right? The investigation targets United Health's Medicare Advantage risk adjustment practices. If federal prosecutors can prove that the upcoding was intentional, that executives specifically directed the use of algorithms and home visits to generate fraudulent diagnosis codes, the exposure is existential. The False Claims Act allows the government to recover triple damages. On alleged overpayments in the billions, the penalties could approach tens of billions. More significantly, a criminal conviction could bar United Health from participating in federal healthcare programs, Medicare, Medicaid, TRICARE, the programs that generate 60% of the company's revenue. This is not a theoretical risk. It is the single greatest existential threat the company faces. And it is a risk that every analyst model, every institutional investment thesis, every corporate roadmap has so far priced as unlikely. The court history of False Claims Act cases against large healthcare companies suggests the most likely outcome is a large settlement without admission of guilt, the same playbook United Health has executed successfully in every prior scandal. But the criminal probe introduces a variable that settlement cannot reliably resolve. What a smarter version of this company would do. First, voluntarily separate the payer and provider decision chain. Not necessarily a corporate split, but a mandatory firewall where Optum's clinical recommendations are made by entities with no financial visibility into United Healthcare's medical loss ratio. Let the physician make the recommendation. Let the insurer adjudicate it. Remove the structural incentive for the two to optimize against each other. Second, open the algorithmic architecture to independent audit. If NH-Predict and its successors are genuinely calibrated to clinical evidence, not cost containment, an independent review will confirm this. If they cannot survive independent review, they should not be used. The company has the data to prove its algorithms are clinically sound. The fact that it has chosen litigation over transparency is the most damning circumstance of all. Third, break up Change Healthcare. Not because United Health should be punished, but because no private company should own infrastructure this critical to public health. The clearinghouse function of Change Healthcare should be managed as a regulated utility like a power grid or a water system with independent governance, mandatory redundancy, and public accountability. The 192.7 million Americans whose data was stolen in 2024 did not choose to have their medical records processed by a United Health subsidiary. They had no choice. That should not be possible. The framework that applies to every company in this position. Here is what United Health teaches us about the anatomy of a monopoly, and it applies to every dominant company you will ever analyze. A company becomes a monopoly not when it beats its competitors, but when it becomes the infrastructure its competitors depend on. The moment a private entity controls a market's essential plumbing, the payments, the data, the authorizations, competition becomes theater. The competitors are renting the rails from the company they are trying to beat. Once that structure is in place, regulatory capture follows almost automatically. Not corruption, not conspiracy. Just the logical reality that a company this large, generating this much tax revenue, employing this many people, ensuring this many voters, will shape the regulatory environment it operates in. The proof? Change Healthcare was blocked by the DOJ and approved by a federal court. The proof? United Health's lobbying operation is one of the largest in Washington. The proof. The ACA's medical loss ratio was supposed to cap insurer profits, and it became the mechanism of a $190 billion internal profit engine. When you see a company that appears indestructible, ask this question: has it become indispensable to the system it operates within? Because the difference between a great company and an empire is not size, it is whether the system can function without it. United Health proved in February 2024 that the American healthcare system cannot. And that is the most important fact in this entire documentary. Here is the one truth this video has tried to build toward. UnitedHealth Group is not a healthcare company that became too powerful. It is a financial architecture that uses healthcare as the legal justification for its existence, and has grown so large, so deeply embedded in the infrastructure of American medicine, that dismantling it would require a level of political will that has not yet materialized. The assassin wrote "deny, defend, depose" on his shell casings. The Senate wrote it into a report. The DOJ is building a criminal case around it, and 192.7 million Americans had it written into the permanent record of a data breach. None of them chose to be part of the United Health ecosystem. Ultimately, the system chose them. In our next investigation, OpenAI, a company that began as a non-profit research lab, explicitly designed to ensure that artificial intelligence served humanity rather than shareholders. And then something changed. What happens to a company when the thing it promised to protect against is the thing it becomes? And who exactly is Sam Altman building OpenAI for? If the answer surprises you, and it will, subscribe now. You will not want to miss it. The most dangerous corporations in history were never the ones that broke the rules. They were the ones that rewrote them. This is Strategy Lens. We'll see you inside the machine.